Children were not protected from the risk of harm because unapproved implantable springs were used in spinal surgery at Temple Street Children's Hospital. That's the finding of an independent statutory review carried out by the health watchdog HIQA. It found that 3 children had the unauthorised steel springs inserted, which should not be used for spinal surgery. Today, the chairperson of the board of Children's Health Ireland, Dr. Jim Brown, apologised to those failed by the care they received and said he is to resign.
In September 2023, it emerged that metal springs had been surgically implanted into a number of children who underwent spinal surgery at Children's Health Ireland Temple Street University Hospital in Dublin. The Minister for Health, Stephen Donnelly, asked the health watchdog, the Health Information and Quality Authority, to conduct an independent statutory review. That 200-page review, published today, has found that the use of the devices was wrong and that children were not protected from the risk of harm.
It's important to acknowledge that 3 children, as a consequence of what happened, had wholly inappropriate material implanted in them. And as a consequence of that, they were put at the potential risk of harm.
The review says that the unapproved springs were inserted in 3 children. A non-alloyed spring steel was used, which is not used for such surgery because it corrodes. There was no evidence of ethical approval at Temple Street for the use of the springs. And the springs were bought from abroad and not ordered or tracked on the hospital business system. There was a lack of governance by Children's Health Ireland, and the report found that the surgeon attempted to replicate an experimental technique he had seen at a meeting in the Netherlands. HIQA found it was well-intentioned but ill-considered. Following the publication of the report, Dr. Jim Brown, the chairperson of the CHI board, announced his resignation and apologised for failings in care. In a statement, Liz McMahon and David Ryan said their son Luke was used for experimentation purposes without their knowledge or consent. 6-year-old Luke was born with spinal muscular atrophy type 1 and scoliosis. In July 2020, a spring was inserted into his back when he was aged 6. The family said this was a breach of trust that resulted in harm to an innocent child, and the family has asked that the CHI board be relieved of their responsibility for the provision of services at CHI sites. Minister for Health Jennifer Carroll McNeill said she would ensure governance issues are addressed at the hospital.
What I want to see is the appropriate governance structure in place to make sure that we have clinical leads who are managing each team. What I want is a culture where people who see things that are clearly wrong not only can step forward and say them, but must step forward and say them.
Children's Health Ireland said today it apologises for the risks that were posed to 3 patients through the use of these implants. And it said that issues of poor performance and non-compliance with policies are being addressed with the staff involved. Fergal Bowers, RTE News.
The HIQA review was the subject of exchanges in the Dáil today, with opposition parties calling for answers over what happened and demanding action from government.
And now we take
Today's HIQA investigation into the use of unapproved springs in child spinal surgery has again raised questions over health service standards. And in the Dáil, opposition parties were quick to seek answers.
This report is a damning litany of failure. Failure of governance, failure of management, abject failure by government to act and ministers to do their job. The chairman of the board has resigned. I am asking you, does the board and the rest of the executive need to follow him?
Taoiseach. While that concern was shared by government, Taoiseach Micheál Martin was clear responsibility lies with the individual rather than officials.
The idea that you would use springs outside of that entire protection framework is beyond belief. And responsibility there, in my view, lies with the individual in the first instance.
The immediate issue addressed, opposition TDs raised the prospect of a public inquiry sought by affected families.
The families are calling for a public inquiry into everything that happened here, how it was able to take place. Does the Taoiseach agree with that call?
A view not shared by the Taoiseach for now.
Inevitably, these inquiries last years. They don't give you the closure, they don't give victims the closure they want. They cost millions. The legal profession, I don't mean this in any negative way towards the legal profession, but there's huge fees involved.
Today's HIQA report has already led to the resignation of Children's Health Ireland's board chair Jim Brown. And with 2 external reports into the same issue still to be published, expect more developments to come. Fiach Rokiona, RTE News, Leinster House.
Well, our health correspondent Fergal Bowers joins us now in studio. Fergal, obviously the most important people in all of this are the 3 children involved. What has the impact on them been?
Yes, at the heart of this are the children and the families involved. Some of the children have since had these unapproved springs removed, which has meant another operation. And this has all shone a light on the governance, or lack of, at Children's Health Ireland in Temple Street University Hospital, and the lack of clear lines of reporting and accountability. This was acknowledged by the chairman of the CHI board, Dr. Brown, who has stepped down. The use of unapproved medical devices in surgery, it's a matter of major concern, especially without ethical approval within a hospital. And lessons obviously will have to be learned about these events, especially as Temple Street and CHI prepare to move next year to the new National Children's Hospital. And it's a concern that HIQA, the report found there were opportunities for Children's Health Ireland to be more proactive in the ongoing care and support of affected children and their families during this issue.
Now, part of the context of this controversy was the pressure to have more surgeries performed to try and reduce waiting lists.
Yes, look, the report does acknowledge that Surgeon A was well-intentioned but wrong. And the surgeon was also facing long waiting lists, and spinal surgery and scoliosis. Have they been major issues that we know over the years, and pressure for a cut in waiting lists? So that's part of a backdrop, I guess. But there are other reviews underway, yet to be completed or published, relating to Temple Street and other children's hospitals on related or similar matters. And we have the statement from Liz McMahon and David Ryan, the parents of Luke. I was at that High Court case in 2003 when they had to go to the High Court to get their medical records released on this issue. Luke eventually had his spring removed after that High Court action, but there was a complicated procedure. The family said today they hope that Luke's suffering will improve the lot of all children.
OK, Fergal Bowers, health correspondent, thanks for that.
Children's Health Ireland has apologised to families after non-approved springs were used as surgical implants in children. A HIQA report found it was wrong and should not have happened. It said that clinical governance was insufficient. Well, we're joined now by Dr. HIQA, Clinical Director of Children's Health Ireland and a consultant in paediatric emergency medicine. Thank you for coming in to speak to us this evening, Dr. HIQA.
Thank you.
Why wasn't there oversight from clinical directors in Children's Health Ireland when non-approved, non-surgical medical devices were being used in these procedures on children?
I want to start, first of all, by extending my heartfelt apologies to the children involved and the parents and the families. I've been fortunate to have met 2 of the children, lovely, lovely children, face to face, and I've met also 2 sets of parents, also on multiple occasions, face to face. I've met the other parent virtually. So on behalf of myself and Children's Health Ireland, I want to sincerely apologise for the failings and the harm that happened to their children. You
were there at the time. Why wasn't there clinical oversight?
I wasn't a clinical director at the time. I was a practicing consultant. But if you look at the HIQA report, it clearly outlines the failings in the governance structures. Either they were not robust enough, or where they existed, they weren't used by the clinicians involved.
This all stems from an attempt to replicate an experimental surgery that was seen at a meeting in the Netherlands. And while HIQA said it was well-intentioned, it was ill-considered. Were you, when you were working there, ever made aware of this procedure?
The procedure, if you are doing something experimental, the natural thing would be to go to research ethics. And I'm aware that research ethics existed even at that time. Right now, what will happen if you want to bring innovation? Because we want doctors to use innovation. That's the core of healthcare. That's the core of what we do. And as a medical doctor, I don't want anything that stifles the ability of doctors to innovate. But what we want to make sure is that there's a balance and that children are kept safe. Parents and children are well informed, and we're able to measure good outcomes and be able to document, and there's a process in place. So what I can say is that right now the process is much more robust, and such an occurrence would not happen now.
We know that there was no written approval given for the use of springs, or, as you mentioned, ethical approval was not sought either. Is there a process in place now if somebody has an experimental treatment that they would like to use, they think would be beneficial to patients? Is it clear what that process is now for clinicians?
It is. It's really clear. So it's really trying to balance having a good process and ensuring that doctors still have the ability to innovate. So if you come across a good treatment that you think will benefit your patients and the families, you go first of all to your clinical director, so the likes of me and two others, and you explain what that treatment is and what's the evidence with that treatment. And then there is a clinical ethics group that we go to. They debate on it, and if they approve it, then it goes to the medical devices group where they do a risk assessment. And if there's a device involved, then they go on then to the acquisition and the procurement. But you can't get a child into theatre, you can't start any treatment unless there is a written authorization to initiate that treatment.
Let's talk about the families and, most importantly, the children involved who didn't get the care that they received. What is CHI doing to support those families? Because we know one family indeed had to go to the courts to get their medical records.
Yes, so all three families are being managed by our spinal team. As you know, we set up a spinal management team that is headed by Mr. David Moore. So they're all in treatment with this spinal team, some getting their treatment in Ireland and some getting their treatment abroad. And I know that before the publication of this report that our new CEO, Lucy Nugent, had written to the families just to notify them about the impending publication of this report.
What is the status of the staff who were involved here?
So I'm not able to talk about individual staff members, but again, I want to I want to also stress that our new CEO has made clinical and corporate governance her key, her top priority, and I know that she will manage that part of the process using CHI processes. If
staff aren't working there anymore or need to be replaced, we know we have really long waiting lists for scoliosis patients, people who need spinal surgery. Have extra staff been brought in to help that situation? So yes, we are in the process of recruiting extra spinal surgeons. I know we are going to do an interview probably in the next month or two. We have also been able to employ other support staff. We've employed more nurses, more admin staff, just to manage the waiting list and ensure that there's a smooth You need the surgeons process. Though, don't you? We do need the surgeons, and we are getting the surgeons. So we have been funded for an additional surgeon, and we're hoping to have that person in post by summer of this year. People will be concerned. We have a new National Children's Hospital due to open perhaps in a year or so. Would you understand if people don't have trust that, although we have the state-of-the-art building, that maybe it's not going to be run correctly? I want to stress that CHI has over 4,000 staff, really hardworking and dedicated and skillful professionals, some of the best in the entire world. Every year we deliver care to over 250,000 children. Fantastic outcomes. What we're dealing with is a very isolated group of clinicians. And I know that the harm that has been done to these three children is immense. And of course, I'm here just to convince you and to convince the public and the parents of our children that this will not happen again. I'm confident we have the structures in place, and when we go into the new hospital, we'll have a fantastic service. All right, Dr. HIQA Okafor, Clinical Director of Children's Health Ireland. Thank you for coming in to speak to us on 6 1 this evening. Thank you for having me.